Do any of you have any advice for, any of you could give any advice to mental health professionals working with people dealing with cancer, people living with cancer, people battling cancer?
Don't tell me what I need to do or how I need to do it. Ask me and let me tell you.
I'll repeat the trauma thing. Being aware of the traumatic effects of the things people are going through, whether it's cancer or any other health issue that might bring that.
I feel very strongly that in life, the best answers, the most important answers to life's most pressing questions are always found rather than given. And I understand my role as a health professional is to support that search. My answers ought not be your answers. It's kind of, that is, but I will be really happy when you find your answers. And along that line for mental health professionals is that you understand the inner wounded child really well. And you understand that we human beings are covered with emotional wounds. And some of us cover them a little bit better than others, but we all have them. And when they get touched, deep pain is evoked. And that can include issues of trust, issues with authority, issues with feeling loved or lovable, issues of feeling enough, issues of shame, and cancer treatment can exacerbate all of these. And so that's why I think that the ideal cancer care team includes people who can respond as a health professional to these, and include development of a supportive community around to support people and hold them as they go through these shifts. And these can be really important. And depression does not mean, it should not fall into the pill for every ill paradigm that many of us are trained in. It has a lot to do with, it's kind of addressing our own brokenness, and it can be done with spiritual care professionals, it can be done with psychological care professionals, but I worry if people go through cancer care and these deep wounds from earlier in life aren't addressed. I can't imagine how recovery could be optimal. And that's why I go back to this idea about, every diagnosis is a spiritual crisis and an opportunity for spiritual growth. And Penny George spoke last week, and she talked about, with her cancer diagnosis, she said she would ask everyone to ponder what invitation exists in their experience. She said, I don't know what it would be for everyone, but it exists. What invitation is waiting to be opened? And I think that's where people skilled in psychological and pastoral care can really help process those and take it further. Ruth, that provoked something, yes?
For some reason, the words death and dying provoke one attitude and feeling within people. But I think that within the cancer community, there needs to be more emphasis on loss and grieving, because cancer is a major change in your life, and no matter what the cancer is that you've had, or no matter what the degree of treatment or the length of treatment or whatever it is, there is that change, and it brings loss of hopes and dreams and things that you thought that you were going to be able to do. And if somehow cancer patients can be encouraged along the way to identify what is lost by this, and then to ask themselves the questions of what is truly lost, what remains, what's left of you, and then what is possible. And that's the invitation, is being able to really say what is still possible for you, no matter what stage of cancer you have, there are possibilities, short-term, long-term, there are possibilities. And I think that if we can look at loss and grieving, and really identify the fact that we're grieving, and that the grieving, just as you said, Heidi, grieving doesn't end. You know, years later, you still run into something and you say, oh, heck, there's a grieving moment. Kind of tied to my cancer right there. But I mean, do any of you at all enter into conversations about grieving?
All the time. All the time.
All the time.
In my professional work at the hospital, people are losing body parts. They're getting things they never expected placed on their body that won't go away. It's a constant conversation that we're having with them. And I also recognize, I've got one lady in particular in mind who is getting a very particular form of chemotherapy that she can only get with us in the hospital. And she's nearing her last round of treatment before she moves on to the next phase. And as her primary nurse, I've been kind of exploring with her, you know you're going to be done with us soon. I know you come in here every 3 weeks, but you are going to be done with us soon, and we won't be seeing you. And that's another loss that you're experiencing. And to recognize that, identify that, name it, and deal with it are really, really important things so that you can continue on the path that you've set for yourself in terms of healing. So for us, it comes up all the time, and then in my role at the church, always, and I'll let you speak to that.
Mine may be different than everybody's, might be a little bit different, but it's finding a new normal, and that's very difficult. And throughout the 3 years, the first year was all about honoring Dave and honoring my kid's daddy and doing something momentous on every occasion, the birthdays, the anniversaries, the Christmases, everything. And that was very difficult. And the next year was about doing whatever it took to just get through. And now we're on the 3rd year of some things, and it's a kind of a happy medium between them. And some things are difficult, like I wanted to take my son to the Wild games like his daddy did, and the Twins games, and we had to give up a few of those things because they're too emotional. But we did go to a Twins game this August, and none of us cried, and that was the first time. So, you know, you find your way. There's ups and downs. It's a roller coaster, and but you find your new normal.
One of the new normals for people is they sometimes refer to as doctor drop-off. And that is, they've been part of a supportive professional community, and then all of a sudden they're done and it's gone. And my fear about that is that they become passive and dependent upon this and have not strengthened their other resources. Is that a fair interpretation? Is that has anyone experienced Dr. Drop-Off here? Yeah. I know what's the best response to that? Marie.
I have a question for you. So, being in the healthcare profession, I'm interested in feedback about how survivors and co-survivors give healthcare professionals the permission to discuss this with them. How the number of people are pushbacks when we talk about alternative medicine therapies, and I'm really sorry, but surgery isn't the right option. And so what would you say in response to patients and families that we in Western medicine have given permission to be, we're never going to die. We're always going to be healthy. It's a very interesting concept from the healthcare provider perspective to help us understand what we can do better in the long term.
I think honesty, you know, sometimes you do have to push, even if they don't like it. And again, I'm going from the caregiver. You know, the very last appointment I was with my husband and his parents in there, the doctor was trying to tell us, that this was it. You have to prepare yourself, but didn't quite say it exactly. And I'm like, oh, just say it, because they're not listening. And they're not. I mean, his parents were in denial till the morning I called them at the hospital and said, you need to get here now. And they even left at like, I don't know, 6:30 that night, even though he was doing bad, and luckily got the phone call and got back there before he died at 8:17. I mean, it's total denial. So for me, it was like, and they wouldn't listen to me. No one would listen to me. And me, it was like, you know, please, doctor, just say it. So maybe they still wouldn't, but they needed to hear it, and they didn't. And it's an ongoing struggle. You know, my mother-in-law told me just a couple weeks ago, oh, I never believed he would die. And I said, Myrna, his very first prognosis was he was given 6 months to 2 years. You know, so it's very difficult for many people, and in many different levels and many different ways.
I would like to think that professionals who go into oncology recognize and understand and are getting much better at having that conversation than they had in the past. 20 years ago, when I first started nursing, it was not a conversation that ever happened. And so it's better, I think, and nursing can support that. Our spiritual support can help with that. You know, we will frequently have full team meetings at the bedside if we know that we're not all hearing the same message. We will frequently get everybody together and see if we can figure it out together and be very clear. I don't know if that answers your question, but I think it's getting better, but it's not there yet.
I think that from the healthcare profession standpoint, it's nice to have you as a co-caregiver or the person themselves actually give your healthcare provider permission to talk realistically with you. Because sometimes that, it's an uncomfortable, it can be uncomfortable. It's, I think it's an important step in the Western medicine versus Eastern medicine, where we are trained to talk about things like that, whereas in Western medicine, we're going to make you better. That's what our goal is.
Culturally, we've become much more sensitive to, we do see a very diverse population of people, and we know from what we've learned, you don't walk into certain ethnic groups' rooms and be particularly honest, because it's not consistent with their cultural beliefs, and you need to know who you're talking to, who you're supposed to talk to, and things like that. So I'm assuming you're speaking more as a homogenous group kind of thing, but we try. I'm speaking for the team I work with, we try.